We did talk about alternative practices on the building level to isolation and restraint. And Kayla, I am so thrilled that there were 0 incidents of isolation and restraint in the last school year at South Shore Pre-K through 8, where you work.
Yes.
How did you do that?
The big thing was our team got together and we made a decision that that is not what we're doing. And it required whole team calibration. When is a physical intervention actually needed? And some of the things Lee talked about, not what do I think the child is going to do, but are they actually hurting themselves seriously or somebody else? And do we really need to intervene at that time? And one of our big pushes is recognizing when you need to tap out. Maybe you're not the right person for this student, and saying, I'm not making any headway. Could somebody else come talk with the student before it moves on to something bigger? Our school also moved to, if you felt a restraint was needed, to calling our principal or our assistant principal to come observe and make sure everything was okay. And then the principal stayed and monitored the student with the special education staff, including therapeutic rapport building if there was a major de-escalation, to make sure you're rebuilding that relationship with that student. And a big thing was stuff can be replaced. Trauma cannot be undone. And that was a big push for our team. And behavior is communication of a need. No one misbehaves just for fun. So is there an underlying learning disability that has gone undiagnosed? Do we need to switch up the student's curriculum? Is this just not the right spot? Do we need to consider something different? Is there trauma? Is there abuse? Do we need to further diagnose the student? My building works with Seneca, and we have on-site mental health professionals, and we work in lockstep with them. And as much as they're able to share with us within ROIs with families, they'll share with us. And what can I do to help that student at school? And again, South Shore is very, very fortunate that we have a great contract with mental health professionals, and I hope every building has that. The other thing I want to throw out there is special ed teachers burn out very quickly for a variety of reasons. My team, I think our average seniority right now is like 6 or 7 years. So we are a seasoned team. And I think one of the things we do have going for us is we've been around and we know outside services and supports that are available to our students. But as a younger teacher, I did not know what was out there. I didn't know how to get my kids what they needed, whether it was rec services, a WISE clinician. Do I need to call the crisis line? Do I need to get in contact with children, their healthcare provider? I didn't have those tools. And as time has gone on, our team has a great toolkit. And if a kid is in a mental health crisis, restraint's not the answer. Talking with their mental health therapist, talking with their parent, what is needed, and also valuing those relationships. When parents work with us, they can tell us before the day even started, he didn't get any sleep last night. So I know the student needs some rest, maybe some breakfast. Focus on those relationships and restraint won't be needed. Work with your families. Come side by side. This doesn't have to be an adversarial thing, but working together is huge. South Shore made a huge push. And at times that was tapping on a teammate and saying, go take a 5-minute break, I got you. So it takes time, and it's definitely hard to break some of those bad habits that have been developed. And I think on the state level, if we are state training, in whether it's right to response or crisis prevention, I'm forgetting what CPI stands for, but the crisis prevention intervention, there needs to be whole state calibration on when restraint is actually needed. That needs to be part of your certification. Giving incidents and deciding, is it needed or not? And that should dictate whether or not you're certified, if you really understand when it is needed and when it is not needed.